morning, my name is Kristen. I'm the nurse here doing the health assessment. For the sake of privacy, this is going to be Miss Jones this morning. So before I do the health assessment, or before we do this, I had Miss Jones fill out a health history form that's submitted separately on Blackboard. Also, when coming in, we're going to come in, make sure we'll introduce ourselves. Miss Jones. Hey, I'm Kristen. I'm going to be doing a health assessment today. I'll be your nurse for today doing that. Before we start, I'm just going to want to wash my hands. I'll come over here and wash them. Put my gloves on. And then I'm going to be looking at your armband just to verify identification. Want to make sure too that we close the door for privacy and that we have the lights on. Make sure the room is well lit so we can both see each other and I can see, any findings in my assessment. Alright. So now that we have the gloves on, I'm going to come over here and look at your armband just to verify identification. Alright, Miss Jones, can you tell me your name?
Ella Jones.
Alright, and your birthday?
February the 10th, 1975.
Alright, perfect. We identified we have proper patient in the room. Okay. Also going ahead and with coming in, before I came in with my assessment, going to make sure that I have all the proper equipment, my stethoscope for listening to her lungs and her heart sounds. I'm going to ask you a few questions just to verify her orientation. Can you tell me where you at today, or where you're at today?
I'm at the hospital.
Okay. Can you tell me what year it is?
2013.
Okay. Well, we've identified that Ms. Jones is an alert and oriented person, place, and time. Also, just by looking, we can see with her appearance, she's well groomed, her hair is combed, her nails are clean and trimmed, well trimmed. Her mood and her affect, she appears calm and cooperative, answering my questions, appropriate for the situation. Also, before we do the assessment, just get some vital signs. Make sure you're stable before we do any physical assessment. And we did that with her temperature being 98.6, pulse running at 78 rate. Her pulse ox was 98% on room air, and her blood pressure was 120/70. So all of her vitals were stable. So we're going to go ahead and continue with your assessment. Are you okay, Ms. Jones?
Yeah.
All right. Okay. Well, first we're going to start off by looking at your neck and just feeling your carotid arteries. Okay. So you want to look that way first, and we're going to be sure to do one artery at a time, not to include both of them. All right. If you look this way. Okay. Now you can look straight. I'm just looking that the trachea is midline and that her skin is smooth and intact and it's symmetric. Okay, moving on down. Well, now what we're going to do is listen to her breath sounds. So if I can set you up, Miss Jones. Okay, we will start off on the back. I'm going to clean off my stethoscope with an alcohol pad. Let's clean it off, try to prevent the spread of infection. Okay, and we're going to be listening to both sides just so we can compare the lung sounds. Starting off at the top, can you take a deep breath in for me? And out. Middle on this side. Okay. And one more deep breath over here. And also, while we're back here looking at her back, just looking at her skin, making sure it's smooth and intact and warm. Okay, now come around to the front and listen to your lung sounds. Okay, deep breath in, and out, and on this side. Okay, I'm going to sit a little bit further. And listening to lung sounds throughout all lung fields, lungs were clear, no adventitious sounds were heard. So now what I'm going to be listening to is her heart sounds, first starting off with the 4 valvular areas of the heart, the aortic, the pulmonic, tricuspid, and the mitral. Get under here. Alright, now that we've listened there, I'm going to be listening for 1 minute to your apical heart rate and counting the pulse. Alright, and after the minute's up, listening S1, both S1 and S2 are heard. Her rate, listening nice and steady, well-controlled heart rate at 75. Alright, so now that we listen to your heart, I'm going to be going down, feeling your brachial and radial pulses, comparing both sides. Okay. We want to make sure that both have equal strength on each side, rating at +2, which is a regular strength bilaterally. Alright, feeling radial pulses now. Also equally in strength bilaterally, +2. Alright, so now that we've felt her pulses in her arms, we're going to now go into the abdomen. Starting just, we're going to be looking, I'm going to look at your abdomen, looking at contour, the shape of it, and then later listening for bowel sounds and looking, see if I see any, or feel any tenderness. Okay, we're going to go ahead and lift your gown up. Alright, and just looking before even doing anything, looking at her contour to see it's nicely rounded, no bulging or distension. Okay, what I'm going to do before I feel, I just want to listen to bowel sounds. Making sure to listen to all 4 quadrants of the abdomen. She has positive bowel sounds in all 4 quadrants. Now what I'm going to do is just lightly palpate for any tenderness, and just make sure to be a light palpation. Over here, testing for the liver, do you feel any pain, any tenderness? Okay. Now coming over here for the spleen, any pain or tenderness?
No.
Okay, good. Alright, well that's it for the abdomen. Now we're going to move our way down, and for the sake of privacy too for this video, we're just going to palpate over her pant legs, but moving to the inguinal area, palpating the femoral arteries. And we want to do the same on both sides, comparing for strength. We have +2 in both femoral arteries. Alright, so we did that. We're going to come down. I'm going to be looking at your legs, inspecting the skin, and also feeling pulses down here. Making sure even hair distribution, your skin is intact, it's smooth, okay? Make our way down. Her extremities, they're equal in length, bilateral and symmetric. So now what we're going to feel is for her posterior tibialis pulses. Go in. Alright, and again, making sure they're equal bilaterally, +2. So now for her dorsalis pedis pulses, again +2, equal in strength. Alright, and making sure your skin down here, your toes, your skin looks good, and good capillary refill down here too. Alright, so that's pretty much it with the assessment. Did you have any questions?
No.
Okay. Alright, well, since that's it for the assessment, pretty much just going to be documenting the findings in her chart, and thank you for letting me do my assessment today for you. If there's anything else I could get you, Ms. Jones, let me know.
Okay.
Alright.
Thank you.
Thank you.
Why is it? Maybe try